Alright, team. The patient presents with atrophic vaginitis, keratitis, and pyomyositis. What are we thinking here?
Those symptoms could point to a few different diagnoses. Atrophic vaginitis could indicate hormonal imbalances, keratitis is an inflammation of the cornea, and pyomyositis is a bacterial infection of the muscles. It's a tricky one.
I'm leaning towards an autoimmune disorder, possibly something like Sjogren's syndrome. It could explain the multiple symptoms we're seeing.
I'm not so sure about that. The muscle infection could be a clue. What about something like dermatomyositis? It fits the bill.
I see where you're coming from, Randall. But what about genetica dermatoglyphia?
Damn it, Frank. You're on the right track. I'm sure of it. We need to perform rhizotomy immediately. It's risky, but it's our best shot at saving the patient's life.
Are you sure about this, Hawks? Rhizotomy is a serious procedure.
I don't know, Hawks. It seems like a long shot. Are you willing to risk the patient's life on this?
I trust your judgment, Hawks. Let's do it. The patient's life is in your hands.
I'll prep the Hawks. Let's save this patient.
Let's do it. Time is of the essence. We need to act fast. Lives are on the line here. Tracy, thanks for seeing me. I wanted to discuss performing a rhizotomy on my patient with suspected dermatoglyphia.
Hawks, I'm not comfortable with that. Are you sure it's the right course of action?
I've been practicing medicine for years, Tracy. I know what I'm doing.
Yes, but you also have a history of being wrong in similar cases. Remember the incident last year?
No, not really. I don't even see how that's relevant.
I'm just concerned, Hawks. Maybe we should consult with a specialist before proceeding, for a second opinion.
If I wanted a second opinion, I'd stick my head in a cow's ass and ask the first person who rescues me.
I understand your confidence, but we need to consider all options. Let's not rush into anything.
Fine, but please understand that I have the patient's best interest at heart. I won't let you down.
Leslie, we have a problem. The patient is not doing well after the rhizotomy.
Oh no, that's not good. What are the symptoms?
Increased pain, numbness in the hands, and a concerning spike in blood pressure. I fear the rhizotomy might have exacerbated the dermatoglyphia instead of helping.
We need to inform Hawks about this immediately. He needs to know that the treatment didn't go as planned.
I'm not sure how he will take it. He was so hopeful that this would finally provide some relief for the patient.
At this point, we just need to focus on stabilizing the patient. We'll understand that sometimes treatments don't go as expected.
The important thing now is the patient's well-being.
What were you all thinking? You nearly killed our patient with that wrong rhizotomy area and misdiagnosis?
But Dr. Hawks, we thought we had the right diagnosis. It seemed like the logical choice at the time.
I still believe we were on the right track with our initial assessment. It's not entirely our fault.
Maybe we should review the patient's history once again. We might have missed something crucial.
I don't know what went wrong, but we need to figure this out before it's too late.
You call yourselves diagnostic doctors. You're a bunch of incompetent fools. I can't believe I trusted you with this patient's life.
We'll do better next time, Dr. Hawks. We'll figure out the correct diagnosis and treatment plan.
We apologize for the mistake, but we can still make this right. Let us work together to find a solution.
I'm sure we can come to a consensus on the correct diagnosis if we just put our heads together.
I agree with Randall. Let's not dwell on our past mistakes. Let's focus on saving the patient now.
I don't have time for this. I'll handle this myself. You all are a disgrace to the medical profession. Don't let me catch you in the office again! So, how's everything going outside the hospital, Johnson?
Oh, not too bad. Just trying to enjoy some time with the family and catch up on some sleep. How about you, Hawks?
Well, I've been knee-deep in this complicated case. Just can't seem to crack it.
Oh, that sounds tough. You'll figure it out. You always do.
Wait a minute. I think I've got it. Johnson, I have to go. Thanks for the chat.
Wait, what? Hawks, where are you going?
I'll fill you in later. Gotta go save a life. I've reviewed the case, and I'm certain it's not dermatoglyphia.
Hawks, you can't just barge in here without protection.
He's right. We have protocols for a reason.
Listen, this is trichothiodystrophy. Mark my words.
That's a pretty hard word to mark, Hawks. How do you spell it?
Trichothiodystrophy? What's the prognosis for that?
Prognosis. It's not good. Progressive neurological deterioration.
Are you sure about this, Hawks?
Absolutely. We need to act fast on this.
Well, let's get moving then. We have a new direction.
Tracy, I finally got to the bottom of the patient's condition. It was a relief to find the right diagnosis.
Congratulations, Hawks. That's great news.
You know, this whole mess with the wrong diagnosis wouldn't have happened if I didn't have such idiotic doctors to work with.
What do you mean by that, Hawks? You were the one who initially made the wrong diagnosis.
Well, my diagnostics team could have caught it sooner.
Hawks, you can't blame others for your mistakes. Take responsibility for your actions.
Silently gets up and walks out of Tracy's office.
That man never takes ownership of his mistakes.